story. At least 51 people.
Yeah, okay.
Hello everyone. So it's so nice to see so many participants have joined as decided yesterday, and I thank every one of you for joining on time. Here is founder of Association of Geriatric Dentistry and Medicine, Tika Athaule ma'am. Welcome ma'am, and thanks for joining. As well as we have experience 42 years experience dentist, Dr. Rajni Ahuja from Jabalpur. As well as there are so many other dentists who are experienced, good clinicians. Dr. Neha Desai is one of them, who is a mentor also for ADC Inclusive. and many all others. So if I'm short of welcoming anyone, apologies. I don't know the introduction of each and everyone, but we are in their group, and that is a permanent group. So we will know each other by time. Anything you want to say, Dr. Smita Athole ma'am? Welcome and good afternoon.
Thank you so much. Thank you. And I wish Dr. Darshika all the very best. She is already on her mission towards service to geriatric population. And she is our upcoming star from Association of Geriatric Dentistry. So all the best, Dr. Darshika.
Thank you so much, ma'am. Thank you.
Okay, so anyone else wants to say anything, or I will proceed to with the webinar. Anyone else is there? So fine. I request Dr. Sakshi Ahuja, today's host, to host this webinar and introduce today's speaker and start the webinar. Thank you. Over to Dr. Sakshi Ahuja.
Yeah, thank you, Dr. Sudhir. I hope I'm audible.
Yes, you are audible.
Thank you all. Good afternoon, all. I welcome all doctors across the India to the Academy of Dental Careers inclusive 162nd online session. I thank you all for your overwhelming response to ADC. Firstly, I wish you a very happy Holi, and I hope you all enjoyed the colorful festival. To begin with today's session, as we all encounter elderly persons in our daily practice, we all know how challenging it is to manage them rightfully. So today, through Academy of Dental Careers, Dr. Darshika Kelkar will be sharing few valuable secrets of geriatric dentistry with us to help us navigate this clinical labyrinth efficiently. To know about her, ladies and gentlemen, she is an alumnus of Naya Dental College, Mumbai, having an extensive experience of 23 years in the field of dentistry. After completing her master's in endodontics, she practiced in New Zealand as a registered dental practitioner, focusing basically on holistic approach to geriatric dental practice. Thereafter returning to India, she started a multi-speciality dental clinic named Smile Co Dental Boutique in Andheri West, Mumbai, that pays special attention to full mouth rehabilitation and geriatric practice. Unstoppably strengthening her approach to geriatric practice, she also pursued postgraduate diploma in microdentistry from University of Mumbai and also owes a certification course in geriatric medicine. Likewise, she constantly endeavors to keep herself updated with the latest techniques of dentistry and indeed is a true inspiration for all budding dentists. So please join with me to welcome her. A very warm welcome to you, ma'am. Okay.
Thank you, Dr. Sakshi, for this wonderful introduction. Really honored and humbled to be a part of this. I hope you can hear me very clearly.
Yes, ma'am, you're audible. You're perfectly audible.
Thank you so much.
Okay, just to start with, I request all the participants to please keep themselves muted for the uninterrupted session. And at the end of the session, we'll take up the queries. Just
Disciplinary team with other healthcare professionals. We all wonder why geriatric, okay, definition is one thing, but why are we talking of geriatric dentistry? Well, 9 million people in India were age 60 and above. So friends, in India, geriatric population is considered as age 60 and above. World over, the statistics says age 65 and above. But we will stick to the Indian statistics. And in 2022, we had almost 10% of the population, which was geriatric. The estimates by 2050, it will rise to approximately 20% of the population. So that is going to be a huge number in another, say, 25 years. 70% of this population, that is almost 100 million, are community-based in the sense that they are either in your neighborhoods, in your local areas. They are nearby who can walk down to a dental clinic and can seek treatment. Also, the average lifespan of all the individuals has increased thanks to the medical technology. We are living longer, but we are living with lifestyle diseases and chronic issues. More and more people are retaining their teeth, and they are going to need attention as they age and grow older. So, friends, understand this. Yes, we sometimes wonder why, implants are very lucrative. Smile designing, wow, it feels so wonderful when you do a smile designing case. But trust me, the satisfaction that you get in treating these older individuals is nothing as compared to the other, at least for me. The blessings that you get from these people, the satisfaction and the smiles that you see on the faces of our senior citizens is just priceless. Patients are desiring quality of life, and it is becoming a revenue generator. More than 75% of the patients in my clinic are geriatric, and my whole focus is on their rehabilitation. So what would be the aim of geriatric dentistry? Is it just about treating them, treating their toothache or whatever they come? No. I would suggest it is treating them in a holistic manner. We are not only focusing on diagnosis, prevention, and treatment of the oral health disorders, but we are also looking at maintaining the oral health of the patient and giving them a quality of life. So before we step on to how we are going to be treating these patients, let's understand what are the different types of patients that come to us. They could be functionally independent individuals, they could be frail individuals, or functionally dependent individuals. So what do we mean by functionally independent adults? Well, these are people who are able to independently function on their own. The decision making is on their own. They are able to perform activities of daily living and instrumental activities of daily living without any assistance. So what do we mean by activities of daily living? Well, routine basic activities like feeding themselves, brushing, bathing, maybe stepping out of the house, going grocery shopping. All these are basic needs and activities of daily living. They are able to perform these activities independently without any assistance. And 70% of our total geriatric population is community-based, and they are independently living. So they come under the section of functionally independent adults. Frail patients are those who have lost some of their independence in the sense that they are still in the community. They are trying to live on their own, but they are being assisted by their friends, family, and caretaker. They do need assistance when they have to seek any kind of treatment, including dental treatment, and 20% of the elderly falls into this category. Functionally dependent elderly adults are either homebound or in institutions. These are the remaining 10% of the geriatric population. They cannot come to the dental clinic to seek any kind of treatment. Services have to be provided to them at home or at the institution. So let's meet one such frail dependent patient who actually came to our clinic for treatment. So that's Kamla auntie. She's somebody who is very, very close to my heart because, some patients just become family to you. And she was one amongst them. She is one amongst them. So let's understand her needs first. She had a fall one day, and see, these patients, they tend to kind of fall frequently because of the decline in cognition and other issues, chronic issues. She had a similar fall one day, and she lost her front teeth. She was looking at replacements because her confidence had gone away. She was not smiling, and she was looking at only fixed replacement. She was not interested in a removable appliance. Extremely stubborn, which can get very difficult with this generation of patients. Always wanted a 10 o'clock appointment, and mind you, friends, 10 o'clock for her, if we give her a 10 o'clock appointment, she would be at the clinic at 9:30 in the morning. And extreme fear of needles. We could make her sit on the chair only for half an hour to 45 minutes, and beyond that, she would not allow us to do any kind of treatment. She got an attack of stroke and was wheelchair bound. Definitely, she didn't have any financial constraints, which was a plus point for us, and we could give her the best possible treatment that we wanted. So what did we do? Well, if she wants a 10 o'clock appointment, we gave her a 10 o'clock appointment. We would patiently listen to her. That included my staff as well. Short, quick appointments. Here, we also took the help of an implant specialist so that we could provide her with specialized treatment painlessly and seamlessly. So easy clinic access. So my clinic is located in a prime area where there is access to wheelchair access is possible. So there are ramps everywhere, flat surfaces, and entry to the clinic is such that wheelchair can be brought right to the dental chair. So that helped quite a bit. And we were in constant touch and collaboration with the physician and the caretaker, who was her husband, so as to keep the appointments to a minimum and still deliver the treatment in the right way. So did we do anything which was very different? Well, the treatment plan still remained the same for us, but what was different was the approach. The way we approached the whole treatment process, the way we made her comfortable, the way we made it very seamless for her. So before we decide on the approach and how to go about with any curated treatment, let's understand the challenges which are faced by the elderly. The elderly come with their own set of issues. Trust me, it is not easy to get teaching. So the biggest problem for them is accessibility and transport, and they are most of the times dependent on their caretaker, their family members, to even bring them to the clinic and seek dental treatment. Sometimes they are unable to explain the exact problem. They are sitting on the chair, but they don't know why they have come to the clinic. They only know that there is some problem. There is cognitive decline. There is dementia, Parkinson's. They are slow in understanding things. And they feel that tooth loss is a part of aging. Friends, we all know that our teeth are going to outlive us. So tooth loss is not a regular part of aging, but this is not the common consensus amongst the lay people. We also see certain types of changes which happen in the mouth, the local changes that are happening in the mouth as a result of aging. So what are these changes that we see? Xerostomia is the biggest issue over here again. Xerostomia could be because of aging and also because of the various medicines or polypharmacy, as we call it. So polypharmacy, so what is polypharmacy? Polypharmacy means that the individual is taking 5 or more medicines in a day. And the effects of these medicines also causes a reduction in the salivary flow. This also leads to mucositis and burning mouth syndrome, smooth surface caries, root caries. periodontal problems because of diabetes, other medical issues, tooth wear, attrition, abrasion, erosion, tooth loss. Big factor again over here is the breakdown of previous dental treatments. Some bridge that was done maybe 10 years back, or a root canal treatment done that was done a few years back, is failing. Cancer and precancerous lesions also become an issue, especially with ages 70 and above. Another most common thing that we see with these patients is ill-fitting dentures. They've probably never changed their denture. They're wearing these dentures for 10, 15 years. They're trying to make do with this, thinking that, yes, these dentures are going to last them a large lifetime. So these are the local changes that we see in the mouth. There are systemic changes also which are happening. And lifestyle issues, diabetes, hypertension, arthritis, depression. Again, depression is something which goes unnoticed, loneliness. So either the kids are abroad, they are staying, the husband and the wife, the elderly senior citizen couple is staying on their own. Maybe one of the partner has passed away, and loneliness is creeping in. Depression is something which is again going very unnoticed. Alzheimer's, dementia, Parkinson's, chronic kidney diseases, and a lot of other medical conditions. So of late, I've been seeing a lot of patients coming with various skin ailments, where they are being put on immunosuppressant drugs like cyclosporin, which can again hamper with our treatment protocols. Polypharmacy, as I explained earlier, 5 or more medicines. In addition to that, they are also probably doing some home remedies. They are taking some Ayurvedic medicines. They are taking some homeopathic medicines, and all that is contributing to changes in the oral cavity. So, who are the stakeholders when we are providing any form of treatment to the geriatric patients? It's not only just you as a dentist and the patient, but it's also the support staff that you have in the clinic and the caretaker or the family member, who is equally important over here. Having known a little bit of a background of what challenges are faced by the elderly and how we should tackle them when they are stepping into our clinic, let's get into 10 simple steps to treat geriatric patients. The first and the foremost, I would say, is empathy and respect. Understand the needs of the patient. It's very, very important that we understand the patient and we do not enforce our thought process on them. They have their own financial constraints. They may have social, psychological issues, physical constraints. We need to understand their issues rather than blaming them for not seeking dental treatments. Let's understand why they are not seeking dental treatment, and let's try and help them out. So here, geriatric assessment is of utmost importance. So geriatric assessment itself is a big topic, and this time is too short for me to talk about it. Probably we can have another webinar where we talk of the geriatric assessment part. But geriatric assessment will include all the above points that I have mentioned: the financial, social, psychological, physical, all points. And then we come to the approach of treating these geriatric patients. Be patient listeners. Give sufficient appointment time. We are always in a hurry to finish the appointment because the next patient is waiting outside. Friends, trust me, give them that time. Sometimes they just want to sit on the chair and talk to you. Probably something not related to dentistry, but they just want to pour their hearts out. Listen to them, give them that 5 minutes. The trust that they develop in you, when you give them that extra time, that extra care and extra effort, that trust doesn't go anywhere. They will come back to you for every possible treatment. They will not only come back themselves, but they will send their friends, their relatives. And it is going to kind of help you in your dental practice. Sometimes they are even unable to explain to you what the problem is. So the right kind of questions, correct probing questions, will help you to come to a diagnosis. So allow them to talk and be patient listeners. This again is a very, very important point, thorough medical knowledge. Pharmacy or pharmacology is something I was never interested in. I'm sure most of us don't like the topic. But we really need to kind of, learn, understand the medications, understand the effects of medications. Another issue that I face every time with my patients is that they are having multiple prescriptions. They are probably going to a physician for their regular checkups. They are going to maybe a skin specialist for their other issues. They are probably even taking Ayurvedic medicines and going to some third person for that. So they have multiple prescriptions. They are unable to explain to you what medicines they are taking. So what I normally tell them is that, bring all your medicines in one bag. Just bring everything. I don't want the names. Just bring everything. I have a look at all their medicines and I ask them which medicine they are taking when. And in case if they are still confused, I either pick my phone and speak to the physician directly or speak to the caretaker directly. Sometimes it's difficult for the patients. We just write a note saying that get consent from your physician. That's it. I can't go ahead with anything else. Just get that consent and then we will look at the further treatment. Friends, understand this. For patients like these, even going to the physician to get the consent sometimes can get very difficult. So why not we pick up that phone, make one call to the physician, understand what the problem is, and then provide with appropriate treatment. So a thorough I can't stress the need for, having information about the various medical ailments, chronic ailments that these patients are facing. It is important for us to have that knowledge. Obviously, dental history is something which we need to know. A lot of times you see patients with multiple missing teeth, a lot of things going on in the mouth. You see multiple caries. They've probably not visited a dentist for many, many years. The one question that I always ask them is, what was stopping you from going to a dentist? Was it the financial constraints? Was it the physical issues where you could not access the clinic? Or was it fear? The answer that I get most of the times is the fear of dental treatment. It's not the number of visits. It's not the money. It is the fear of dental treatment. The fear of pain, fear of sitting on the dental chair, fear of or phobia or some bad memories of some previous pain encounter during the course of treatment. So let's address these fears and treat them, find solutions to these fears as to why they have not accessed dental treatment. Another thing that we need to understand is that what are they desiring? What is what are the treatment outcomes that they are looking at? So a lot of patients are not concerned about the oral hygiene, and sometimes it's very difficult to motivate such patients. So probably for such patients, it's only about doing emergency treatment, relieving them of pain. But there are some patients who want to rehabilitate their mouth. They are looking at a solution. And in such cases, understand what their expectations are so that you can provide them and guide them correctly. This is another important thing, convenient appointment scheduling. Don't force your time onto them. Don't tell them, no, 2 o'clock is the only time you can come. There is no other time. No, that's not how it works. They have their own sleep times. They have their own times when they are taking their medicines, and they have their meal times. We need to respect that. Mind you, these individuals are also looking after the house. Their family members, the younger family members, are out of the house working. And these are the people who are looking after their grandchildren, making sure that the house is functioning properly. And they have their own schedules. Just because they are senior citizens, not working, retired individuals, that does not mean that they don't have a schedule. It could be a very simple thing that they are dependent on their caretakers to bring them to the dental clinic. And, certain times are not possible to them. So I have certain senior citizens who come only on Saturdays because that's the only day their family members can bring them. So we have to accommodate them at the time frames that they are requesting us. Please consider this. It's very important. Preferably morning times is what I see them. I prefer to see them because they are very fresh in the mornings and they are not very fatigued. Avoid long appointments. They cannot keep their mouth open for a long time. So either break down the appointments or give them a break in between, maybe a 10-minute break where they can just talk to you, they can have a cup of coffee with you, and then you can kind of continue with further treatments. They are undergoing an aging process. The aging process, there is cognitive decline, there is visual and hearing impairment. So we need to be very, very precise in our communication. We should be clear with our sentences when we are talking to them. We should face them and talk to them. Lip movements also help in these individuals understanding what we are trying to convey. Short-term memory loss is another problem, especially with dementia and Alzheimer's. They will keep repeating the same question again and again to you. Please answer them patiently. They are not doing it on purpose. They do not want to annoy you. Probably they are not remembering or understanding this. So maybe you might have to answer the same question over and over. I've answered the same thing today. Tomorrow when they come back to me, the same question comes back. You can even write down everything in their mode of communication, whether it's a WhatsApp message or it's on pen and paper or a printout, and you can give it to them so that they can go through the instructions that you have given them. Mind you, these senior citizens are very, very WhatsApp savvy. I have most of the patients who tell me that, okay, ma'am, just send us a message on WhatsApp and we will reply to you. They make WhatsApp calls to us, and they do connect better when we are messaging them on WhatsApp. So you understand the mode of communication, you ask the patient, and then deal with it accordingly. Something which goes without saying is a trained support staff. They have to empathize. They have to understand the different needs of a geriatric patient. So my staff is trained to help them move anywhere within the clinic. They even go down and help them to avail local transport. So, simple gestures like this make life very easy for our patients. You also have to train the staff for home visits. So probably a previously mobile patient who used to come to your clinic to seek treatment is now homebound for a particular reason, and you have to see the patient at home. Please do provide them with these services and ensure that your staff is trained very well for all these things. Pleasant clinic interiors, adequate lighting, adequate signage, firm chairs from in the reception area, which makes it easy for these patients to get up or sit on the chair. Soft cushions, we feel that they look very luxurious, but it's not at all comfortable for senior citizens. It's very difficult for them to sit on such a chair or to even get up. Wheelchair access, if it is possible, and a ramp so that the wheelchair can be brought right till the dental chair. I know in certain places it is not possible, but if you are planning to kind of focus your attention on geriatric dentistry, then these are certain things that you will need to provide to your patients. Treatment considerations, again, a very, very big topic. How do you come to a certain treatment plan? But just a small gist is to make appropriate treatment plans as per the needs of the patient. What is the patient desiring? What are the expectations of the patient and the caretaker also? So, depending on all those things, you need to kind of plan the treatment. Also, medical conditions need to be taken into consideration. So if the patient is on certain medications, we sometimes can't go ahead with extractions, we can't give implants, we can't do surgeries. So in such a case, rather than not doing anything, maybe we can give a removable appliance for the time being, so as to help them chew their food properly. So these things need to be taken into consideration. In addition to that, when you're treating them on the chair, train staff with good suction so that water does not get collected in the throat or in the mouth. Semi-reclined position. You put them in supine position, they're extremely uncomfortable and they also tend to gag sometimes. So a semi-reclined, I know it is not the best position for us to stand and work, but that is how these patients are comfortable. So a semi-reclined position is the one which is recommended for these patients. Give them adequate breaks, allow them to close their mouth because fatigue does set in otherwise, and it's very difficult for them. There is muscle loss of muscle mass, sarcopenia. It is difficult for the patients to keep their mouth open for a long time. Maybe bite blocks can help, or just adequate breaks. Just allow them to close for a few seconds and then ask them to open the mouth again. Poor reflexes are again something which I mentioned, and for that, it's very important that you keep them in a semi-reclined position. Diet counseling also is equally important here. Nutrition and diet counseling, especially, after the rehabilitation, so as to maintain their physical health. So do consider this too when you are approaching in a holistic manner. I would like to throw light on little treatment options that we give to homebound individuals. These are patients who cannot come to the dental clinic. It's very difficult for them. They are either homebound or in an institution. For such individuals, preventive therapy is extremely important. You can provide them with emergency treatment in the at home, but along with that, it's very important that you also kind of, teach and advise them with preventive treatments like fluoride applications and SDF applications, so silver diamine fluoride applications, to arrest the caries. So that they, because they cannot be given the adequate services, at least let's kind of take care of the oral hygiene by giving them preventive measures. Use of electric toothbrush, also the caretaker who's looking after the patient needs to be explained how to look after the oral hygiene of the individual. These are small points again for patients who are homebound, and collaborate with the caretaker and the physician before deciding onto a treatment plan. Sometimes a patient cannot make multiple visits. They can make only a few visits. So your treatment plan has to be such that you can, kind of incorporate the best treatment in these short visits that they can do. A thorough medical and dental history is of utmost importance over here. Well-trained support staff and easy access to dental clinic, collaboration with the physician and the caretaker and your multi-specialty team. Your team of specialists is also important. So adding life to years rather than years to life is something that I look for when I am treating any geriatric patient. That's the end of my presentation. I would like to thank Academy of Dental Careers and Association of Geriatric Dentistry for all their support that they have provided to me over here. So Dr. Sudhir Dole, Dr. Sakshi, Dr. Smita Athavale ma'am, big thank you for all your support and motivation over here. Just to share a bit about Academy of Dental Careers, Learn, Grow, Share, Unite. Wonderful mission they are on, where they provide not only free online education programs, but also personalized education courses. Association of Geriatric Dentistry, I am a life member, and I request all of you to take up the membership. The website is there where you can kind of fill up a form and you'll get the necessary information, or you can mail the secretary at the association and be a life member. We are looking forward to creating more and more awareness amongst all the dentists all over India regarding geriatric dentistry. This is my email address and Insta handle. So in case if you have any questions later on, please feel free to approach me and I'll be more than happy to answer them for you. Thank you so much, everyone, for your patient listening. Small quiz, as was requested by Dr. Sudhir Dole. So these are the questions, and if you can answer in the chat box, it would be really nice. Dr. Sudhir, Dr. Sakshi, over to you now.
Participants can come on video also. I request everyone to come on video, as well as after the conclusion at the end, we have to take a photograph, because this is very overwhelming response and you all guys are very sincere. I hope 2 of you will win and you get the benefit of attending the course from today's speaker, Dr. Darshika ma'am. So you can come on the video, one option. You can come on audio, and you can answer in the chat box also. You take your time, but the first one who will answer, that will be the winner. If 3 are the same answers. Okay. So let's start. Ma'am, you will ask the question, or I have
Yes.
to?
No, whatever you want me to ask. The first question is what percentage of population is expected to be 60 plus or above the age of 60 by 2050?
I think Dr. Neha has raised her hand. You want to say anything, Dr. Neha?
Yes, Dr. Darshika mentioned 20% by 2050.
Yes, that's right.
Anyone else is there who want to answer? That's why I said come on the video, so you get the chance faster. That is the interesting part. Anyway, time is up. So next, let's go to the next question.
So this is a true or false? This is a true or false question. Frail patients can perform activities of daily living without any assistance. Is this true or false?
False.
Dr. Sudhir, can we request them to put up the answers in the chat box as well? So
Yeah. You put it in chat box. Doctors, I request you to put it in chat box, because we are not able to understand who is answering. We are very sorry. So chat is
I have already put it in the chat box. Dr. Sucheta.
Fine.
strike the odd one out. Local changes that can be seen in the geriatric mouths. Mucositis, excessive salivation, tooth wear, tooth loss. Of these 4 options, which is the odd one?
Excessive saliva.
Yeah, ma'am, if you could just put it in the chat box also. Sorry, I believe Dr. Sudhir is checking, because I can't see any of the participants. So
Write in the chat box. The one who answered the audio, that excessive saliva, please write in the chat box. Or you tell your name, who said on audio. What's your name?
Sucheta Sathe.
Thank you, ma'am.
Ma'am, fourth question, ma'am.
Again, a true or false question. Elderly patients are usually comfortable in supine position during treatment. Is it
False.
true or false?
False.
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 Yes, it's false.
Dr. Neha, right?
Dr. Anupama.
Oh, first you answered before Neha.
Yes, yes, sir. Yes.
Okay.
I'll answer the first one, the fourth one. I was the one who has been saying that. Anyway, I don't care. I'm just getting one.
I have written in the chat box.
We'll count.
That's fine. I don't care.
Sudhir, you will have to end up giving gifts to everybody. They've all been very patiently listening, and it's an overwhelming response over here.
We have given many of complimentary gifts also. We have lots types also. No issues. Let's go ahead. Anupam, Dr. Anupam and Dr. Neha,
Dr.
who are the winners for the fourth
Yeah,
one.
the last question is give 2 preventive treatments for homebound individuals.
Dr. Asta is trying to talk, I think.
Okay. Can I stop my share now?
Yeah, you can. Please go ahead.
I think Dr. Manik has written it first in the chat box.
Okay.
No, but that is not.
Okay.
I'm asking for preventive treatments for homebound individuals.
Can
So
we
very
elaborate
specific answer.
more so
No, it
that
was SDF and fluoride application also, right?
Yes, that's right.
Yeah.
So we are done, and Dr. Neha has given 2 answers. Dr. Anupam has given 1 answer. Dr. Suchita ma'am has given 2 answers, and now Dr. Manik Joshi ma'am answered 1. So
I
winners.
actually answered 2. You guys got it wrong. I can't help it. That's okay.
No. We'll count that. So I'll correct. Dr. Manik Joshi ma'am answered 2. So we will discuss. We will coordinate with respected speaker and finalize and send you the details for the course, and you can attend the course and avail the discount or concession fees, and any gift is there that also will be informed to you. But it was informed only concession for the hands-on workshop course, 1-day course, ma'am, right?
Yes, yes. We are looking in future for a 1-day course where all these points will be taken into much more details. As I said, geriatric dentistry, I can talk on geriatric dentistry for the whole day. It's a very, very extensive topic and something which I'm very passionate about. There's a lot much more to learn here. So we are looking at a 1-day future course, but yeah, we will kind of get onto it very soon.
Okay, we have that group, permanent group. There you can put all the details. There will be no other promotion of other courses. That is exclusively for geriatric dentistry. Once again, thank you, Dr. Smita Athole ma'am, for giving the opportunity. Wonderful presentation by Dr. Darshika ma'am. Wonderful. And the sincerity by all the participants is like unbelievable. Each and every one who registered ma'am has attended it. This is first time happening. Otherwise, people generally register but don't attend. But this time it is happening that everyone has attended. Someone, I think, because of meeting ID or password, some wrong happened. So congratulations to everyone, and all the winners are women. So happy Women's Day. Speaker is a woman. The founder is a woman. So
Okay.
all respect and dignity to you all. Apart from doing your home domestic work, professional work, now you are extracurricular activities doing like being speaker and now coming into the training part. So congratulations, many congratulations to you, and wish you lots success, and it should grow. We will register for the membership also, and I am a ozone therapy specialist, so I am already part of it. But I learned today especially for 65 plus years, how to deal with them. I'll go through the video once again, which will be put on the YouTube. Anyway, all of you, please come on the video. I need to take a photograph.
Dr. Sudhir, I think Dr. Manik Joshi has raised her hand. She has so do you have a question, ma'am? Or
Yeah, first I would like to just thank you for talking on this big, very, very important topic. Most of our parents also who are now senior members, they get neglected, and this is a wonderful topic to talk about. And yes, you are right that you can go on and on once you start on this topic. I would like to know that when would be the hands-on, the live thing that you just mentioned? Would it be in Bombay or Pune?
so
Assuming Bombay, since you're from Bombay.
yes, it's most likely going to be in Mumbai.
Okay.
But we still have to work out the details on all of this. We will keep you posted. We are looking at, see, Dr. Manik, let's be very frank, we are looking at some amount of participants, some number of participants before we
Yeah.
can open up, because that's what we are looking at. And looking at this response, I'm sure we should be able to do it very soon. So we will definitely keep you posted.
Okay, I hope you keep in Pune also.
Dr. Smita ma'am is there, ma'am.
Yeah, I have attended hers, Pinda Athawale, right?
Yes.
Yeah, from IDA. Yeah, I had attended hers for
She's in Pune,
IDA.
so yeah, so we can work something around for sure.
That if many participants are there in Mumbai, you can be organizer, ma'am, Dr. Manik Joshi, ma'am. You can be organizer and invite Dr. Darshika, ma'am, as a speaker. You become the organizer, but you have to arrange the participants.
That's the most important part. Okay.
Then it is easily possible and smooth process will be there, and you get the benefit also.
Okay. Okay. Yeah.
Okay, please come on
Thank
the
you,
video.
guys. Thank you.
So I'll share the group photo and then end the meeting. Please, I request you from bottom of my heart, please come on video. There is a application which when you come on the video, I'll click the button. Please come on video, each and every one. 25 were there, 4 have left already, like our school and colleges. Anyway,
oh yes, Dr. Smita Athawale, I remember. Yeah.
Yeah,
it's a fiesta time for everyone.
Yeah, for Dr. Darshika Kelkar. Yeah, I think it's done. I'll check later. Thank you so much. Thank you, everyone.
Please share the link of the recording. We would like to share it with our members who could not see it today for some reason or the other, but we would love to see it.
As this is a free webinar, it will be available on YouTube for each and everyone, for public also.
Share a link with us. Maybe Darshika will be able to.
I will connect with you. I will coordinate and I'll connect with you, ma'am, and I will share the link as soon as I get it.
Thank you so much. Thank you. It was a lovely webinar. Thank you so much.
Apologies for any mistake is there, and if less of any respect and dignity to any one of you, all the doctors. Thank you so much.
Thank you.
Thank you.
Yeah.